Good afternoon. Welcome to Bariatric Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center and the CEO of CHRIAS and the chairman of United Medical ACO. And I have Dr. Isaias Irgau with me here. Dr. Irgau, how are you doing?
I'm doing very well, Kemal. Thank you. It's always great to be back on Bariatric Friday.
So, I just finished my other session. So then we were talking about this the other day. Sometimes it does impact my energy if the issues are really depressing, and it was a little bit depressing. So hopefully we can make it more fun. I'm so glad that we are having these, because these events, just having this conversation is almost like a therapy for me. So it does help. Now, our program, we do this on a weekly basis, so everyone knows that by now. But since we have some new patients, and then they may be just starting from this point, so then we want to make sure that everyone also knows our other program, our other surgeons and other members. So with the new format that we have, things are a little bit different. So it's going to start right on the bottom of the screen. So Dr. Irgau is always with me here, Dr. Gail Wynn, Dr. Mike Peters, Dr. Roel Singh, and Dr. George Ibrahim, and Dr. Sachin Maid on the colorectal side are our surgical team. And then also we have our dietitians, which needs to be updated. And the program is pretty much, we have a new member, that's why it needs to be updated. But our program is pretty much focusing on patients with morbid obesity, and then how we can actually take them safely from the decision that they make and to the time that they actually do the surgery and even after the surgery. So just briefly, Dr. Irgau, if you can just give the background and the qualifications on in case some people again are just watching this first time. So if you can give the brief background, and then because we have two patients that we start the process and then they're waiting. So go ahead.
Thank you, Kemal. My name is Dr. Irgau. I am the president of CHRIAS, or Christiana Institute of Advanced Surgery, and my specialty is weight loss surgery or bariatric surgery. I have been performing bariatric surgery now for 20 years, and with my colleagues, we're by far the most experienced group in our area when it comes to bariatric surgery. So what is bariatric surgery? Well, bariatric surgery is surgery that is performed to help people lose substantial amount of weight, and that is to treat a disease that we call morbid obesity. Now, there are clear indications for bariatric surgery. A person's weight has to be at least 100 pounds over their ideal body weight for them to qualify for bariatric surgery. Or another way to quantify this is to talk about a body mass index greater than 40. Sometimes a body mass index between 35 and 40 can qualify a person for bariatric surgery if they have already developed certain illnesses related to obesity, like type 2 diabetes, sleep apnea, or high blood pressure. So in brief, those are the key qualifications for bariatric surgery.
Dr. Irgau, thank you. And in this format, on our Bariatric Friday show, the episodes are single topic. So then, since we are going through the process, we are able to just go through one topic each week. And some patients some topics are even for after the surgery. So there may be patients who are watching this after they have their surgery. So we are trying to get everything in like 18 to 20 sessions, which is about 18 to 20 episodes. That's usually 25 weeks cycle that we go through this. And then this is our fourth cycle, actually. So, and because we are trying to put this in a different perspective and then communicate in a different way, anyone can actually watch any of our videos. They're all there in our channels. So in this one, our goal is to kind of put a different spin on how we are actually sharing the information. So now I have two patients, and some of you who already watched these, you already met these patients. So, well, first we have Katrina. So don't judge me how I pick these names. I have no idea. I just random. Katrina is 37 years old. The BMI 47. And she decided to go, when we did the surgery type session, she decided to go with gastric sleeve. And then we have our second patient, Samantha. Samantha's situation is a little bit different. She's slightly older. She's 62 years old. And she decided to go with gastric bypass, and that's what we recommended for her because she has heartburn and diabetes and sleep apnea. And so between these two patients, we are trying to walk the process through with you guys. And then I have our superhero, Dr. Irgau, helping these patients with their decision. So today, our discussion is going to be around the care coordination, and we are going to explain what these patients are going to go through, what type of help they are getting from us. So, and Dr. if you can give the background on the care coordination process, and then tell us why we do need this process, because it's something that we build this together, and we have several nurses, several other members of the program who are getting together on a daily basis. But if we can explain the care coordination process a little bit.
Absolutely, Kemal. So both Samantha and Katrina have struggled with weight for a very long period of time. They have tried all diets known to any human being, and they have not succeeded, which is the most common story, right? And then, obviously, the thought of bariatric surgery had crossed their minds at some point, and at the beginning, they probably rejected the idea, thinking that they could do it by themselves. This is not for them. And then over time, the idea that bariatric surgery is actually not an option, but a necessity, came to their mind. And that's when they've decided to come for a consultation for bariatric surgery. But once both Katrina and Samantha decided on bariatric surgery, they expected to have the surgery the next day, the next week, or that same month, right? As soon as possible, right? Because they dreaded the idea of carrying this weight for much longer. But when they come to our office, we tell them, no, the surgery cannot be done tomorrow. The surgery cannot be done in 2 weeks' time. This is not treated like any other surgery. This is not like a hernia or a gallbladder surgery where you come, we make the diagnosis, and we schedule the surgery. There is an extensive preparation period that requires the input of different specialists, right? And we tell them that, and we explain to them that the reason we need that is because we need to prepare them, not only for them to be in their best and optimal situation for the surgery, but for them to be prepared to succeed for a lifelong of healthy life, right? With bariatric surgery, we're not just making changes in the digestive tract, but also preparing the person to become successful in fighting off weight for the rest of their life. That's why we require this preparation, which includes evaluation and education by different contributors. We have dietitians, nutritionists, and you've mentioned the ones that work with us in our practice, Kemal. We need a psychologist's input. We need to do endoscopy to evaluate the upper portion of the digestive tract to make sure there are not issues that we need to take care of before the surgery. We need to do blood work. We need to do a chest x-ray. We need to get both Katrina and Samantha seen by a heart doctor. They may not have had any heart problems, but we know that underlying heart problems that are not readily evident are very common when people are overweight. We have to uncover those problems and take care of them before the surgery so they can sail through the surgery safely. Both Katrina and Samantha are at high risk of having sleep apnea, which needs to be addressed. So we may need to do a sleep study before. So just by saying that now, I've opened up the need for a number of consultations. And the last thing we want to do, Kemal, is give them the scripts and tell them go and find those specialists and have it done and then come back to us, right? It would become a nightmare for them to navigate this, but it would be suboptimal because we will not be able to get all the information that we need before the surgery in a timely fashion. And that's where you come in with your bariatric coordinating team, Kemal, right? Because once Katrina and Samantha have received the orders to go to see a dietitian, a psychologist, a heart doctor, a lung doctor, to undertake EGD, to undertake blood tests, to undertake chest X-ray, they need somebody to help them navigate the system, right? And follow them through. And we're not talking only about 1 or 2 patients. Samantha and Katrina are just 2 of the number of patients that come through our practice. We have to have a system that really enables us to really help the patients go through the system without being frustrated, so they can really get the most out of it, which is education and proper evaluation.
And because there are a lot of different steps that they have to go through, and different, although in our system, we're an accountable care organization, we are part of an accountable care organization, it does help us to have the specialties in the same domain, same network. So, but in some cases, patients are going in different places, but in some cases, patients are in different regions. Like this morning, I have to transfer one of the patients to a different program, just because patient already had issues with mobility and the transportation, and it was just not the right thing for them. But so many different things that they have to go through. Now, one of the things that we do to help the patients is how we can actually make this process easier. Like in the old days, we used to hear the complaint of like, there wasn't enough communication. Now the complaint is different now. So now it's like, okay, too much going on. So, well, there isn't anything called too much communication, because we have to make sure that we are getting them ready. So now just looking at these 2 ladies and how we are going to help them. So one of the first things that we want them to do is their blood work. And then the psych clearance is one of the other important things that they need to have. And once we have those, we also have the sleep apnea home test, home sleep study. In many cases, most of our patients are getting. So now already you are with 3 different practices and 3 different locations. So a nurse who's assigned to you would be able to, would be the point of contact, and then you would be able to communicate everything through that person. Of course, while we are doing those visits, those studies, you may be seeing your physician as your surgeon, because we do have follow-up meetings. So just to kind of put it in perspective, maybe next week I will update their insurance information. So did I have the right stuff up there? Okay, yeah. So on there, when I'm introducing them, I will have their insurance information. So if Katrina has a Blue Cross, she can be ready in as early as 2 months. But if Samantha is on one of the Medicaid, well, Samantha is not that lucky, so she's going to have 6 weeks, 6 months, 6 consecutive months nutrition classes, which makes it already challenging. So that's why we are here. So your care coordinator, who's a nurse, would be able to walk you through and make sure that those appointments are being scheduled for you. But the only thing that we need, Samantha and Katrina to answer their phones when we call them, or text us when we text them. And most of our patients, of course, do. But what's amazing for me is what we were able to understand with our patient population. We are not judging. That's something that we discussed last week with the stigma of morbid obesity. And this is something that I learned from you in terms of the medical conditions of the patients, and not never judging the patient for the situation that they are in. but we know the reality of this process, and many of our patients being morbidly obese for a long time, they have issues, and they need that push, and this is where our care coordinators would be able to help, because every time, so when we go through the daily process of case conferences, what I see is, okay, how can we make sure that this patient complete the process? So there are already so many different challenges, and every day we get a report back from the process that person is going through. Now, we may be looking at your case once a week, but the nurses are looking at it every day. So in many cases, the blood work, why do we want the blood work to be done? If in the case of Samantha, she has diabetes. If she didn't actually, if the diabetes is not under control, meaning that if the A1C is not less than 8, we may need to work with an endocrinologist, which we do need enough time to prepare her for that additional clearance. So we are actually here with all different elements of the system, elements of the program to help the patient to complete the process. Now, Dr. Erkan, do you get any feedback from the patient with our new emails that we are sending them, like from the database?
Yes, I do. So patients really appreciate that very much, Kemal, because it gives them a way of really staying in touch with the office without having to call the office on the phone and be on hold and having to really rehearse every time, right? When they have a bariatric coordinator that they name, they know they have a name of that person, and that is communicating with them either via email, via text, and sometimes by phone, it makes it a lot easier. It's almost like a VIP treatment, if you think about it, right, Kemal?
It's a super VIP.
It's a super VIP treatment, right? It is. And our patients definitely deserve that, for them to be able to really navigate through this process. Kemal, you mentioned the fact that one of the insurance plans actually requires patients to go through this process for 6 months, right?
Yeah.
Which means
6 consecutive months.
6 consecutive months, right? Which means that they cannot miss 1 month. If they miss 1 month, they have to repeat the process again. Now, if we were to leave things for patients to sort out by themselves, given how busy life is in this country, you can imagine how many patients would actually miss that month, and their process would not take 6 months. It would take even longer than that. It could take a year. It could take even longer than that. And the longer the process drags, the more frustrated a patient becomes, and then they could be disillusioned and then just throw their arms up and not do it at all, right? Come on. So the fact that we have the bariatric coordinating nurses follow with the patients, proactively schedule the appointment for nutrition from the get-go, so they have it on their calendar. It is set on that day for them to go. And then if for some reason they were not able to go, or for some reason that appointment did not happen, the bariatric coordinator knows in real time that that has happened, and they will be able to follow up with the patient and say, hey, we don't want you to miss this month. Otherwise, you may have to repeat everything. Please make sure you go on this next available appointment. And they help them make that appointment. So all these really helps the patients stay on course. And it helps us bariatric surgeons also have patients that not only are well prepared, but they are also comfortable with the process. The last thing a surgeon wants is a patient who is frustrated with the process, right? That have lost faith in the process. That is not the way we want them to start the process. We want them to be
absolutely not. Yeah.
And that's what we see in our patients when they go through our program. And I have to say, Kemal, I mean, this is really unique in many ways, because as I said, it's almost like holding hands of the patients and guiding them through this complex process. And that builds so much confidence in them, and they start really the process ahead in terms of their optimism and how well they will do overall.
Absolutely. So now the one of the challenges the care coordination process they may see is if they have moderate sleep apnea, then we do need clearances from a pulmonologist. Usually requires a CPAP treatment, and both both of our patients, Samantha and Katrina, do have sleep apnea. And some patients are struggling with the CPAP, the machine itself. Anything you would like to address there?
Absolutely, absolutely. So sleep apnea is a condition whereby people don't have restful sleep. And the reason they don't have restful sleep is because a fair amount of tissue in the back of their mouths interferes with their ability to breathe, get adequate oxygen, and expel adequate CO2 during their sleep. So they have restless sleep, right? Now, having the CPAP machine actually forces air to go through the obstacles in the back of the mouth so that they can get adequate oxygenation during their sleep. This is a treatment for sleep apnea. Now, when sleep apnea is moderate or severe, this treatment is very important as we are preparing them for surgery. Now, paradoxically, most of our patients are actually referred to us because sleep apnea will be resolved once they lose weight. And we know that bariatric surgery is the ultimate treatment for the vast majority of patients who have sleep apnea. However, for patients who have moderate and severe sleep apnea, it's important that as they go through anesthesia for bariatric surgery, they are being treated adequately. Now, we have to educate our patients to make them understand how important this is, right? So getting the CPAP machine, going through the process, obviously is challenging, but it is critical and it's important for their safety. And once patients understand and they are well educated, they will go through it. And again, why is our bariatric coordinator system so helpful, Kemal? Because just getting the sleep study, getting the results for the sleep study, getting to see the pulmonary doctor, getting the prescription for the CPAP settings, using the CPAP machine, getting compliance with the CPAP machine, these are multiple steps that somebody who has no familiarity with it will find very, very challenging. And yet our bariatric coordinator who are doing this day in and out are able to guide our patients and are able to refer them to us when there are challenges that we need to overcome for them to be able to do so.
And the other thing that we see, not with very young patients, but if they are, they have certain conditions, cardiology is one of the other clearances, and cardiology also happens in a way that there's an initial visit. Usually they have a stress test or stress echo based on the patient's conditions. Now, because my other job is I'm the chairman of the UMACO, I look at this not just from the bariatric side, but I'm also looking at it from the actual standard of care that we are providing for the patient. And when I see some of our patients going through these specialists first time, so they actually don't really, there are some conditions, some illnesses that they don't think that they had, and then they are being able to diagnose, which is extremely important for the prevention or early detection, so then something that can be addressed. So every time I see those, to me, like, I mean, we don't want to give the bad news to someone, but the good news is then it's detected. So like, what if it wasn't diagnosed? Like, what if they didn't go through the process? So then they have to complete their stress test. And many of them, they don't need to have the returning appointment. Usually if there are no problems with the stress test, they are cleared. Now, throughout this time, Dr. Ergau, you, from the surgeon standpoint, you guys are also seeing the patients, especially with the pandemic, with the telemedicine, we did kind of increase that number. How's that going so far? And then what do you find from the patients in terms of the process?
It's great, Kemal. It's great. Now, the frequent interaction with the patients has two very important advantages, both for the surgeon and for the patient. The first one is that we are able to really follow through on what is missing in their preparation, but also address certain issues that they may come up when they have these evaluations. As you mentioned, for instance, a patient may go through a cardiology and the cardiologist may find that there is an issue that needs to be addressed, right? We are able to discuss that with the patient. The patient understands how important it is to follow with the cardiologist for that. They may have endoscopy, and on endoscopy, there may be a finding that we need to address. Well, the patient being given an order to get a treatment without really discussing and understanding what that treatment is, doesn't help very often. But when we have this encounter, we are able to explain that to them. The other important issue, Kemal, is that when we first have the consultation with patients, the patients come up with many questions, and very often they forget their questions. And they tell me that very often. Despite all their attempts at writing and remembering, they don't. Plus, they may have questions that arise after they start the process. The encounter with us gives us an opportunity to clarify these things and to educate them more. So I find these frequent encounters actually come out extremely helpful, and they are making really the quality of our preparation even much, much better than it used to be.
No, that is extremely important. So, like one of the live events we did this week was part of our diabetes program, and Dr. Gary Singh, who's a cardiologist, he joined us. He has done several sessions with us in the past. Even for us, this is a learning. Every time, we do these sessions, and I have no problem telling people when I don't know something, I'm going to say I don't know. Or if I learn something from you, I'm going to say, well, I learned this from Dr. Erkan. So in that session, the interesting is how diabetes and high cholesterol, they are actually related to the dementia, which I never heard of that before. And then we deal with so many patients throughout the process, not just with the bariatric, but from the ACO side. And we pick up new stuff every time we do these sessions. And the patients, they have a lot of questions. There are a lot of unknowns. So I think I feel like there's a good process in place to let them, digest what's happening. At least digestion is not a problem in this process. They already have digestion problem on the other side. So at least we can help them to make this more pleasant experience. But in that session, Dr. Erkan, one of the other things that we provided as an update is by 2030, 1 in 2 adults in the United States are projected to have obesity, which is over BMI 30. And then 1 in 4 is projected to have class 2 or class 3 BMI over 35. So the 1 in 4, this is based on the projection and prediction, I guess. And then in our earlier sessions, we had different things we discussed. And, one of the statements I made, we are not just guessing things, we are making predictions based on what's available to us today.
Yeah. Yeah.
And knowing that this disease is so costly and impacting people's lives, we just need to make sure that this process is pleasant enough so that they can actually, they don't drop out from the program. Now, just to kind of mention it again, 83% of the 83% the patient's diabetes will have resolution, which 82% is with the cardiovascular disease when they finish the surgical program after the surgery. 72 to 98% the range, the reflux, you don't like when I call the fancy medical terms. I guess that's heartburn would be a better one for reflux.
Heartburn, yeah, heartburn.
So, and then 74 to 98% of the sleep apnea are gone. So what I don't understand is sometimes when we are trying to treat the patients on the primary care side, patient has sleep apnea, oh, well, you have to follow up with the pulmonary. And then, BMI is 50. The only reason patient has a sleep apnea is because they have morbid obesity and there's nothing there. Oh, well, because we don't want to hurt the patient's feeling, but no one wants to use the CPAP machine long term. If that's something that can be short term, that would be ideal. But if we don't solve the actual problem, the root of where this problem is coming from, everything that we are doing is going to be inefficient troubleshooting. Absolutely. And that's just waste of everyone's time. And we don't want to we don't want our patients to go through that, because we take this, like many people that really, like, they think that we are just, we make these shows and then we just go home, Dr. Erkan. So like 8 a.m. is the case conference 1 and 10 a.m. is case conference 2. This is the entire year, so it never stops. So because if you don't do that, we know that there will be a lot of patients who would be dropping out because they don't get enough support. So the care coordination is important from that point. And we want Katrina and Samantha to be healthy and happy. Anything else you would like to add, Dr. Erkan?
Well, Kemal, I can tell you that as a bariatric surgeon, I could not be more proud to be practicing in this setting where we are preparing our patients so well that it's almost flawless in terms of how the whole process goes through. Mm-hmm. And I can tell you, hearing the comments of the anesthesiologists, for instance, right? Anesthesiologists are probably the specialists that our patients will meet very, very last on the day of surgery, right?
Sure.
The anesthesiologists actually love bariatric patients. And the reason they love bariatric patients is because these patients are prepared so well. All the information they need, treatment of the high blood pressure, treatment of diabetes, evaluation of cardiac problems, treatment of sleep apnea, all that is ready and laid out for them, right? And so they have a high level of confidence when they take care of bariatric patients, which, in the past used to be the biggest challenge for anesthesiologists because there is airway issues and other things. In times in which bariatric surgery did not have such a thorough preparation, bariatric patients were a greater challenge for anesthesiologists. In practices like ours, where we have this very thorough preparation, anesthesiologists actually love to take care of bariatric patients. And that's what you see there.
The preparation, right? So if
Absolutely.
If you prepare, and that's patient selection process and going through the preparation and getting them ready. That's not just for this, but anything else that we do in life. Preparation is the most important part of the long-term success, and I'm glad that we are able to do that, and we are able to touch many people's lives, and having people be happy with their outcome. And when I see their survey results and how happy they are, that actually makes us extremely happy. So we want, hopefully we can help more people, more patients. And until next week, please stay safe, and we'll see you soon. Thank you for joining us.
Nice weekend, everyone. Thanks, Kemal.